11 and a half. My middle son is 8 and my baby is 6. Nurse, so my training basically just steered me toward vaccine or die.
I mean, yeah, you'll get the most training.
Yes.
Because you must have given vaccines.
Yes, I did.
So what did you used to think of people that would come and say, I don't want to, or question the shots?
I thought they were putting their children at great harm, at great risk. I genuinely thought that. And so I didn't think twice about vaccinating my first son. And he received all of his vaccines on schedule. And we started noticing that something was wrong when he was about 2. His milestone, he was always a little bit lagging on his developmental milestones, but also as a pediatric nurse, I didn't worry about too much about that because it happens, and he was the first baby, and he was still a happy, content, just a good baby. He was just a really good baby. And every now and again, somebody would bring up autism, and I thought that was insane. He wasn't autistic. There was nothing grave like that with him. And then we got him started in a developmental preschool in upstate New York. He was about 2.5, and actually a little bit beyond 2.5. And the director there, she had been around a really long time, and she just kind of laid down the law, and she wanted to bring in a developmentalist to do an assessment on Griffin, and he did, and at the time he even felt like Griffin was intellectually disabled. I really took it as a challenge, so I sought out a developmental psychologist to get my own evaluation done. And at that point I had my middle son, and he was just an infant. He was 3 months. And on December 17th of that year, 8 years ago, the developmental psychologist, confirmed that yes, it was autism. But I continued to vaccinate my middle son because I hadn't yet gone down the vaccine rabbit hole, so to speak, and I wasn't willing to believe that could be it. And then something just gave me pause, and I thought, I don't have to do it. It was the first time I'd ever realized I didn't have to give my children vaccines when people were telling me I had to. I had never thought that before. It had never occurred to me that I could just wait. And so with my middle son, I thought, I'm just gonna wait. And he got his last pediatric vaccines at 9 months. Time went on, and it became more and more apparent that my eldest, Griffin, was not only autistic but intellectually disabled, like really affected. Mm-hmm. Rowan is definitely cute. Rowan is, talk. Yes, he can have a conversation with you. He can, he has friends. He's on track. My 11-year-old can't even read. So when I got pregnant with my third, my husband and I both agreed we're just not going to vaccinate. There just wasn't a good reason to. And he's now 6, and you can see in him, you can see a little bit of the quirk that especially my middle son has. He gets excited, he gets a little bit flappy, or things get loud and he doesn't like the loud. But he's a typical 6-year-old. He runs around and he makes friends like it's nothing. He can read. He reads beautifully. He can have this great conversation with you, and you're like, yeah, that's a conversation with a 6-year-old talking about going into outer space, or animals he sees, or the latest insect that he finds interesting. And my husband and I, it wasn't actually that long ago, probably like about a year ago, we both looked at each other after knowing Aiden, our youngest, for 5 years by that point. And we realized that if we had vaccinated him, he'd have problems too. I mean, it became clear to us. So it's like we gave birth to this little experiment.
Mm-hmm.
Like, it's just so obvious when you look at it that I followed that stupid pediatric schedule to the T. And I'm gonna pay for it for the rest of his life. And my middle one, I stopped at 9 months, and yeah, he'll have little challenges, but we can overcome them. And the third one, I wouldn't let anyone touch him with a needle. But you can see, and it just... And I realized if I had just given Griffin a chance, if I had just waited, if I had just given him an opportunity to grow up. I never even held my baby unvaccinated. They shot him before they put him in my arms, and I'll never know what he could be like because I can't take him away. And I get to grieve. Because I have 3 boys who need me. It's not like they're dead. They're in my house. They need me to be there for them. I don't get to do this on a daily basis. I don't get to unload and get it off my chest. My husband was driving by, we were just running errands, and he saw this bus, and he made this crazy U-turn. I'm like, what are you doing?
So you just saw this bus from the road?
Yeah. And he was like, we need to see what they're doing. We knew about this project. We knew about RFK Jr. and the Children's Health Defense, and I didn't think I was going to give an interview like this, but my husband just really wanted me to do it.
I'm so glad you did. It's so important, because you've been to sea for so long. They trained you as a pediatric nurse that vaccines were.
I can remember I was working on my master's. I was working on my master's at the University of Pennsylvania, which is the most elite nursing institution in the world. And the stuff they told us about vaccines in that class, first of all, it was only half a day to talk about vaccines, to go over vaccine science. And physicians don't get it any better. They don't spend any more time. They don't have there's not a full class on vaccinology or any of these things. Not that it's mandatory or anything like that. It's glossed over.
What would they say? Give me some examples.
The big one, and this was the one that kind of gave me pause. Griffin was already going on 2 years old when I took this class. I think he was about 2. The big one that I found so shocking was the instructor vaccine detractors talk about how people are making so much money with vaccines. Vaccines don't make people any money. And I was like, I'm not quite sure what this has to do with taking care of kids. Like, why this is even a point in this lecture. But it stuck. It kind of like stuck with me, and it wasn't that long. I don't remember. It couldn't have been long after this lecture. It might have been the clinical I had while I was in this class where this lecture took place. But I was doing a primary care pediatric rotation. I was training to be a primary care pediatric nurse practitioner, and so I was at a clinic in Wilmington, Delaware, and it was a very big deal. They made it a very big deal that us trainees, us new people coming in, understood that there was one refrigerator for vaccines for children with insurance and a wholly separate refrigerator for vaccines in a whole different part of the clinic for the vaccines for children who did not have insurance. So the CHIP kids, the kids on Medicaid. And I didn't understand at the time, and nobody could explain, not that I was willing to really ask questions, but I look back on that, especially, taking the time to learn a little bit more about this stuff, and it just makes me sick. Like, why? What did it mean? What did it mean if it wasn't about the money? But the professor in my class said it has nothing to do with the money, that, people like to claim that this is somehow a money-making scheme, money-making operation. I'm like, well, then what is it if it's not money? That you have to have them in two totally separate refrigerators because, God forbid, an uninsured child gets one of the vaccines from the insured fridge. And what are those vaccines in the chip fridge? What was it called? I can't remember. Vaccine. That's too strange. That's too bizarre. Why would you segregate like that? What's the point? I don't understand.
It's dark.
So the average person isn't aware of it, and I wasn't the average person. I was a nurse. I'd gone to
Pediatric nurse.
I was a pediatric nurse. And there's strange games being played with all of these things that nobody's talking about. Who knows what they are? Who knows what the games are? But unsuspecting mothers are being told, you're putting your kid at risk unless you do these things. And I look at my 3 boys and I screwed up. I didn't take time to learn the things I should have learned, but I don't know where I would have learned them. I don't know. I mean, the biggest problem is you just can't take it back. Once you do it, you can't take it back.
I'm afraid that is the biggest problem, yeah. This is why we're trying to warn people, because it's painful. The whole thing's painful.
And warning people. You don't have to do this. Get to know your baby. Get to know your child, especially your first. Like, you don't know what could innately be going on with your kiddo. I look at my youngest and I can see that slight hint of quirkiness. And causes this cascade of problems.
It's also feeling and everything else. Would you go back to being a pediatric nurse?
Well, after COVID, I don't want to go back to nursing, period. There's just been there's just been too much deception. And I watched it with other nurses. Just, they got fed these stories and they were made to just fall in line, and you couldn't question anything. I couldn't believe the whole mask nonsense. Not to go on to a different point, but I remember talking about this in nursing school, how in the surgical suite we wear masks to keep our spittle out of an open wound and to keep the bodily fluids out of an open wound from splashing in our faces, because you have to talk, you have to communicate with your team. That's all the mask was for. But now all of a sudden it's science that it's going to prevent infectious disease, and it's like, and I watched former colleagues of mine, they were willing to die on that hill. Like, not want to be friends with people, not want to associate with people anymore who were like, this is dumb. This is not correct. It's not correct. Because we sat in the same lecture hall, had the same silly debate over it. But now all of a sudden, because your job's on the line, I guess, I don't know. It just, American healthcare is no longer about taking care of people. It's no longer about doing the right thing. It's no longer about doing what's best for the patient. The patient never benefits. Somebody else benefits. Everywhere you turn, it's becoming clearer and clearer. It's not about taking care of people. It's not about wellness. It's not about health. It's about somebody's bottom line. Then it's the same with these vaccines. It's somebody's bottom line. Because otherwise, you look at this bus, you look at stop and ask questions. We should have asked questions 30 years ago.
For taking the bus and bringing you to us. So it's really important.
Thanks.
Thank you for